Welcome back, Ventura. Well, I'm here with Juanita Trine, and I've known Juanita since before she was born, I think.
Long time.
Long time. We had worked together with children with cystic fibrosis who are now, I have to tell you, adults with cystic fibrosis.
Wonderful.
Which is a wonderful thing. And I asked her to come here today because we have a program in Ventura, really just here to serve all of Ventura, which is the CATCH program to help with COPD. And of course, first thing that came to mind was someone who's been working at this for a while. So Juanita, tell me, what's your professional background and what are you doing now? And then we'll talk about the program that you're teaching.
Okay. I'm a respiratory therapist. I've been, doing this for a lot longer than I'd care to admit, but it's been a wonderful thing working with people who need help breathing. Respiratory therapists do work with all kinds of different patients, from neonates to the geriatric patient. And that's kind of, in a nutshell, anything that deals with breathing we work with.
So you go to school and then you end up in the hospital working in intensive care nursery or the adult ICU, and then kind of choose a path. And I don't know how long it's been. What path did you end up choosing?
I was working on the floor with patients and then rotating into ICU and CCU in the emergency room for a very long time. And then my path kind of led, surprisingly, into pulmonary rehabilitation. So
pulmonary rehabilitation, I'm a pediatrician, of course, and pediatric pulmonologist, and my kids are growing up and running out of breath as their cystic fibrosis advances, and helping to really get that CATCH grant up and going to, again, serve all of Ventura. Whereabouts do you do pulmonary rehabilitation?
We do it at Community Memorial Hospital in Ventura.
So we've got information about how to sign up with it. So I think you wear two hats. So tell me about your two hats.
I'm the pulmonary rehab coordinator, so I run the pulmonary rehab classes. I teach patients. I do everything that's needed to check with insurances and interviews and gathering all the paperwork that we need, documentation that actually shows this is a medically necessary intervention. And then doing everything related to the class, teaching and supervising the exercises as they're going through. My other hat is coordinating for the Better Breathers Club, which is a really fun thing. We have once-a-month meetings. People come in. Anybody who has difficulty breathing or the support people for them, everybody's welcome. They're free. You can just come as you can. Once you come in, you're not required to show up for every meeting thereafter, but it's a great group of people, and they really are really sweet, and there's a great deal of support that goes on, as well as a lot of learning as well.
Well, let me circle back to the pulmonary rehab. What we do know, we're trying to prevent people from going back in the hospital.
Right.
We know if we're very active in pulmonary rehab, especially that 30 days after, that's really what helps to keep people from re-entering the hospital. What kinds of things do you do in pulmonary rehab? Where do you do them?
We start out where people are able to. So someone who comes in and has not been very active, has not had a lot of activity in their life, their exercise tolerance is going to be a lot less. So for some people, just to get up and sit on a stationary bike and pedal for 1 minute is really a victory. So we start where they are. So even if you're not doing a lot, you begin in a small starting point, and then we just build on that as we go throughout the class.
Are you able to involve the families in the Better Breathers Club or in pulmonary rehab so they can continue these things at home?
Absolutely. Better Breathers Club, as I said, support people are very welcome. So we've had grandchildren, we've had daughters and sons, you name it, we've had them come. So they're always welcome. Pulmonary rehab, we like to involve support people as well. So they're welcome because having a second set of ears is really nice. We're teaching people things they need to know in order to live better with the chronic lung disease. So when you've got that second pair of ears, there's somebody there who's hearing all the information, learning how to help with breathing. What do you do? So that, because it's such a frightening thing when people can't breathe, that it's so easy to panic and to become really scared, and that makes your breathing so much worse. So if you've got these techniques and you're practicing your breathing and you know that there's things that you can do to help keep that under control, sometimes in your panic you might forget, but if you have someone there with you, they can remind you and say, remember, do your breathing, try and keep relaxed. All those little things can really help. So they're most welcome.
If can't get my breath, Juanita, what am I going to do to help myself to breathe? What kinds of techniques do you teach people?
We talk about pursed lip breathing. That's a huge help for patients to help keep that breathing under control. Also diaphragmatic breathing. And then again, just that relaxation, because that panic and that fear just escalates the shortness of breath and makes it so much worse. So the more you can relax and remember to do your breathing techniques, the better it is.
So what diaphragmatic breathing, is that?
Belly breathing.
So I put my hands on my stomach and breathe from my stomach instead of my lungs. So,
exactly.
So we get some feeling. I've put some people in yoga to try and...
Very similar, yeah, the breathing works very well. If you've been a diver, if you've played a wind instrument, anything where you have to have a lot of breath control, singing, those people really know about the power of the diaphragm and how it makes breathing just so it's much easier to do, much more energy efficient. So
let's circle back again to the pulmonary rehab, and you were saying part of your job, sometimes seems like 90% of our job is finding ways to get paid. Is pulmonary rehab covered by insurance then?
Generally it is by most insurances, yes.
So it saves them money in the long run.
Absolutely.
And then in terms of the Better Breathers Club, are there activities associated with the Better Breathers Club? The hospital is the one that helps to support the...
The hospital supports the meetings. We just have the meetings once a month. And so those are something that is free, and there's no cost to that at all. Anybody who wants to can come. And here we have speakers that come in talking about breathing related issues as well, but we also do just even stuff about staying safe in the home and medication management and all kinds of other topics that are of interest to our group. So it works out really well. There's a lot of really good information being exchanged, and then people have an opportunity to talk and share and kind of understand, because they do understand exactly what the other people are going through. When they say, boy, it's a bad breathing day for me today, then they understand that and they say, I know what you mean. And it's just so nice to have someone that really does understand and can relate to what you're experiencing.
In terms of your speakers, then these are staff members at Community Memorial Hospital who come speak? Or?
Not necessarily, although we have had some staff members come in as well, but we depend a lot on our community to come in and speak. So we've had fire and police department people come in. We've had, gosh, I'm blanking right now, but lots of different people.
What would a fireman talk about? What did he talk about?
They talked about what happens after you call 911 and what that whole experience is like. So that was good. They also came and talked about safety in the home. So that was another really good topic that we had them speak on. So,
what kind of safe things can people do in their home?
Keeping things well lit. Making sure that you have your floors clear, so no little throw rugs that people can trip or slip on, things like that.
Well, that sounds good. And then in terms of smoking cessation, of course, how do you talk about that at Better Breathers?
We do cover that with pulmonary rehab. A lot of times, most of the time, people have already quit. So we do have, I'd say the majority of people are non-smokers by the time they come to us for pulmonary rehabilitation, but there are some who still smoke. So we obviously encourage them to set a quit date and to go ahead and hook them up with resources and that kind of thing. So there's a few of those around the county as well, as you know. So there's some really good resources for that. But it's really important. You don't want to keep continuing to smoke and insult the lungs and continue to cause more and more damage. So it is the best thing, one of the best things you can do for your health.
Oftentimes with these kinds of Better Breathers clubs, you end up having ambassadors. You've impressed them and they go out and find their friends and find other people. Do you have any stories about any of your ambassadors, people who've unexpectedly gone out and brought in people from the nursing home, or maybe got a fireman to quit? That would be really, really nice.
We've had folks that have gone out and brought friends in, and I have a very dedicated lady, Virginia, who is my caller. She goes and calls everybody and reminds them about the meeting that's coming up and tells them what we're going to be talking about. I couldn't do this without her. She is just a wonderful woman. and just a real sweetheart in general too. So it's a pleasure, and she's just so representative of all the folks in the group. They're wonderful.
So what are some other things that you teach there? Do you teach about, everyone's got a nebulizer, and sometimes I'll do a home visit on patients. I've got green things growing out of the plastic balls that haven't been changed in a long time. So is there a curriculum for nebulizer care too?
We do cover that as well, how to make sure that the stuff that you're using is something that's really going to help you and not create more problems for you. So certainly cleaning is important. We do cover that. We talk about diet. We'll talk about medications, how to properly use inhalers, because it's kind of confusing. There's so many different, you've got the dry powder inhalers and you've got the little puffers and all those other things, and people get confused about how to properly use them for the most benefit that you can get. So we'll cover all of those. We talk about ways to save energy. There's just every day we have a different topic, so we've got all kinds of things we talk about.
Well, Juanita, thank you so much for joining us. Ventura, Better Breathers Club, pulmonary rehabilitation, and you sons and daughters, let's get grandma and grandpa out there too. We want them around for our kids. We'll be right back.